Can y'all hear me? Is this all right? Okay, there we go. Cool. I don't know when the last time I've used a microphone is, but we'll give it a shot. Hey everyone, my name's Jake Tabor. I'm a community organizer with a group called Massachusetts Senior Action Council. So we've been around since the 80s. We're a Massachusetts-specific group. And what we are is we do advocacy. So we're all about essentially seniors coming together in numbers to make sure that our politicians listen to our concerns, and that they actually, fix a lot of, the major senior issues. So some of our big things has been trying to lower the cost of Medicare and mass health, expanding it to more people, improving access to, the kind of care that we need. We've been about trying to expand home care services. We've worked for a really long time to try and make sure that people have the option to age in their own home if they want and not go to a nursing home. Expanding things through like the aging service organizations has been a big thing for us. We've worked to keep transit accessible. So the MBTA ride, we've worked to make sure that that is protected. It's been subject to possible cuts for a really long time, and we've tried to make sure that it stays as an integral part of the T. We're also working, obviously, to make sure that any kind of transit that seniors use, if they're giving up their cars or if they're, using it for just to get around wherever they're living, it's accessible and that it's actually, something that you're happy to use as opposed to, being an ordeal. So we've worked on a bunch of other issues as well. Housing, we organize a lot of seniors who trying to improve their housing situation, trying to make sure that their housing authority actually has the services that they need. So all these sorts of things we've been doing for the past more than 40 years. We've got about 1,000 members across the state. We have 6 chapters. Probably the closest one to you guys is in Cambridge/Somerville. But we also, if people are able, people can join us virtually via Zoom. I know that some people, that's a difficult thing, but we've helped a lot of people connect with us that way since COVID. So I guess I'm going to talk about a couple things, and again, I'm happy to stick around for questions, whatever questions people have. So I'm going to talk a little bit about this thing, the Medicare Savings Program. And then I'm going to talk a little bit more about some of the other work we do, how you can get involved. I'll try and keep my portion of the talking to a little bit less so that I can give y'all more time for questions. And if you're at all interested in reaching out to us, any of the things that I handed you have our office number, as well as our Senior Action Leader, that's the newsletter that we send to members of our organization. People join our organization as members for $10 a year, and they get the Senior Action Leader. We let them know whenever there's local meetings. It's essentially, we want to make sure that, alone seniors are often not listened to by politicians, but if we can get the numbers and come together, then they can't be ignored. So that's kind of our main goal. While we're out here in the world talking about our organization at the senior buildings or councils on aging, we're always trying to make sure that people know if there's been an expanded benefit recently. And this one is important because it's actually been the primary thing we have been working on for the past 12 years. Medicare Savings Program. Essentially what it is, does anybody know about what happens if you have mass health and then you turn 65? Exactly. Your asset limit is only $2,000. So if you have mass health and if you're under 65, there's no asset limit. It's just calculated based on your income. All of a sudden you turn 65, your health care needs haven't changed. You're still in need of the same care, likely even more. But all of a sudden, for people over 65, if you have more than $2,000 in the bank, then you can't get mass health anymore. All of a sudden, you're responsible for Medicare and Medicare costs. So people are all of a sudden left, paying co-pays, co-insurance that before they didn't have to pay, and now they don't have the savings for. And again, people being penalized for saving some money, putting aside a little bit, however small, not being able to get health care. It's ridiculous. It doesn't make sense. So what this program is, now, one of the big things we're trying to do right now is expand mass health to more people so that you can, if you're on mass health, you don't have to have $2,000 in the bank. You can have more assets. You don't have to spend down all that money to stay on mass health. That's probably our biggest thing that we're trying to convince the politicians to do right now. In the meantime, though, we've passed Medicare Savings Program. Essentially what this is if you're one of those seniors who you can't get onto mass health because your income's a little too high or your assets are a little too high, this is essentially a pot of money that the state has set aside to help you pay for your Medicare costs if you are under a certain income. So for individuals, if your income's under $2,844 a month, for a couple, if your income's under $3,853 a month, you should definitely apply if you haven't already gotten it through, whatever your healthcare assister or whoever helps you with your healthcare. What it does is it'll pay for your Part B premium. That is the $170 that gets taken out of your Social Security each month. It can pay for some of your Part D costs, including like your prescriptions. It gets you involved in the Extra Help program. If you're actually even lower income, if you're under $2,405 a month as an individual, then you actually get access to a program that'll pay for all of your Medicare costs. So it used to be this program was way, way more limited, basically only available to a few thousand people who just scraped over the mass health limit. But over the past 12 years, we've expanded it to more and more and more people. And in March, there actually used to be an asset limit on this. We got rid of that asset limit. Now it's only based on income, whether or not you can take part in this program. Couple misconceptions. One, this is not Medicare Advantage. This is not change your coverage. This is not a different Medicare plan. Whether you're on Advantage or whether you're on traditional Medicare, you stay on that plan. All it is money that the state uses to help cover some of your costs. Again, whichever Medicare plan you have. If you have a supplemental, you would keep it if that makes sense. For some people, under that 2,405 number that I mentioned earlier, for a lot of people, it actually makes sense to get rid of your supplemental, the people that we've seen. Again, that is up to you, but those people find that costs that weren't covered before under their Medicare that they had to pay for, all of a sudden are covered, so they no longer need their supplement. So for a lot of people, it can be significant, and regardless of where we go and what percentage of wherever we go, this is going to be relevant for. We always want to mention it because there's always someone out there for whom it's relevant. So again, where do we go from here in the future? So when it comes to if you or specifically any of your friends, anybody that you know, if this applies to you or your friends, they can definitely call our office, which the number is right up there and it's right on that flyer I gave you. Now, we're a very small organization. We primarily, do advocacy. We've got 7 staff members, myself being one of them. But we do have a few people who we have actually set aside a portion of their time to help people with these applications for this program. So we still have capacity. If you think that people want to, if you think this is going to be relevant for you or anyone else, you can call the number and we can talk you through the application. In the future, we want to expand this even more. Right now, that 2,844 number, that represents 225% of the federal poverty level. It's a number that gets redetermined each year. Federal poverty level is adjusted for inflation the same way that Social Security is. So what we want to do is we want to get that up to 300% of the federal poverty level. We want to expand this program even more so that even more people can get the Part B premiums paid for, even more people can get extra help on their prescriptions. So it's all about continuing to do what we've done for a really long time, which is going to the State House, lobbying our elected officials, showing up in big numbers. I should have brought a photo with me, but a little earlier in the spring, we had an event where we packed the State House with 100 people wearing these blue shirts, which are kind of like our calling card, just showing our politicians like how serious we are about expanding mass health and this program. That's what I would say about the Medicare Savings Program. There's a few other things I wanted to go over, but while it's fresh, I wanted to see if anybody has any specific questions, either about that or about mass health. Anything else I brought up? Yeah. A lot of the confusion comes up when people realize that these programs are administered by Mass Health. The Medicare Savings Programs are not Mass Health standard. Mass Health standard is, Medicaid. That's where, it's the under $2,000 in the bank account thing. Medicare savings programs, they're also called, this is frustrating that they call them this, but they're also called mass health buy-in programs. When people hear that for the first time, they say like, I don't think I'm qualified for mass health and I don't want to buy anything. It's like, no, this is the Medicare savings program. It is for people who are on Medicare, but under a certain amount of money, and it'll pay for some of your Medicare costs. Oh, no worries. Oh, so yeah, they were talking essentially about, whether or not it made sense for her to keep her supplement or to keep her supplement or her current level with the assistance that she gets. So she was just talking with, I'm sorry, your name one more time?
My name's Fred.
My name's Fred. He's a SHINE counselor.
I'm here representing the SHINE program. It's a statewide program, volunteers in every council on aging here. And if you're interested in a in-person, unbiased, face-to-face review of your Medicare and or your mass health Medicare savings eligibility, you can just go to the front desk and tell Sue you'd like a SHINE volunteer to talk to you. All of the information, this is great information, but if you want someone to talk with one-on-one about it.
Yeah, we pass folks to SHINE all the time, especially if there's a question, about, which supplement should I get? What's going on with this current supplement? If you have questions that are specific to you, we'll often pass you on to SHINE. So, good question. It depends. Yeah, I mean, it depends on, because essentially you can think about it like Medicare Savings Program has a few tiers. There's one tier that gives, it gives less support for people who have more income. And then there's another tier that gives more support for people who have less income. So we find that most of the people who get the program that gives less support, I'm using those terms because they have confusing names like qualified individual or SLMB. Those programs only pay for your Part B or some of your Part D prescription drug costs. So if you still have other procedures that would be covered under different parts of Medicare, then you may still need a supplement to cover some of those. But we often... Right. Yeah, the one that is a higher level of supplement is for people who make under $2,405, and that covers all of your Medicare costs. We often see that for those people, it makes sense to give up your supplement. Obviously, we always recommend people, for instance, go and talk with a Shine counselor before they do that. But all it is just that what you may have had to pay coinsurance for before, if you didn't have a supplement plan, you wouldn't anymore if you were under this higher benefit, the QMB program. The other categories, we do actually, yes. So let's go down and it's a little bit. So this is that 2405 level, what people call QMB, Qualified Medicare Beneficiary. So that is where it pays all costs of your Medicare Part A and Part B covered services. Now, like like Shine counselors will tell you, there's some, we've been seeing some issues with some providers who don't know what this program is, and they're confused. And so, okay, but you're on Medicare, but you're getting all your costs paid for. So if that does happen to any of the people that we work with, we ask them to call us, and then we get in touch with the provider, because sometimes they're not familiar with the QMB program. Yeah.
And you get a Mass Health card, but it's not Mass Health.
Only with this higher level of supplement QMB. And that's what confuses a lot of the providers, is that you get a Mass Health card, but you do not have Mass Health. You have just Medicare, but all of your Medicare costs are paid for. This is, no one said that it was, worked out in a way that made the most sense. But, where you would run into that is if you have been working with a provider that takes Medicare, but that does not take Mass Health. And all of a sudden you come to them with this Mass Health card, but you don't have Mass Health. And they get a little confused. But Mass Health has sent out notice to every provider in the state, basically saying that it is illegal to reject someone for being a part of the QMB program if they don't take Mass Health. So, anyways, it's definitely not the way that we would have set it up, but at least people are getting their costs paid for. Other questions? Sure. So SLMB and QI pays for your Medicare Part B premium. That's the $174 a month. And it automatically enrolls you in the Medicare Part D Extra Help program. That's your prescriptions. So that is all the help that you would get under the QI or SLMB. Under QMB, it pays all the costs of your Medicare Part A and Part B covered services, as well as your Part D. So it's a higher level of help. Other questions? No, different. So yeah, Mass Health covers more. It's a different program. This is, if you have QMB, you still have Medicare. It's just that whereas before you would have had to pay a number of different costs associated with Medicare, now the government would pay those costs. But yes.
This is talking about deductibles and copays under the QMB program. Is that?
So it pays for those. These are deductibles and copays that you would have to pay if you didn't have the QMB program. But now the state will pay those copays, so you don't have to. Yeah, of course. It depends. It depends. There are a lot of different Medicare Advantage plans, a lot of different, and they offer a lot of different, either benefits, a lot of the people that we've seen, well, let me phrase it this way. There's a lot of people that have gotten, benefits from having a Medicare Advantage. Maybe they don't have a lot of a certain kind of healthcare costs, but they have a lot of dental costs, and this is going to help them, or they have a lot of vision costs, and this is going to help them. Where we have seen issues is if someone signs up for a Medicare Advantage plan, especially if it is marketed heavily to them, and then, but they are, when they signed up for the plan, they were unaware that a certain aspect of their care that is covered under traditional Medicare is not covered under this Medicare Advantage. So you have to be sure, if you're getting Medicare Advantage, that whatever care is most important to you is still going to be covered. Because we've seen some people get some really unfortunate surprises. Yeah, so Massachusetts, there's a lot of, I think we do pretty well as far as this Medicare savings program, as far as helping out people who just have Medicare. We're pretty bad when it comes to mass health. We're very restrictive when it comes to, allowing seniors to get mass health standard benefits. In California, there's no asset limit at all, and the income. Yeah, and the income limit is a lot higher. So you've got a lot more seniors who are getting mass health standard, which again is more comprehensive than Medicare because they have mass health standard, I get confused because it's not called mass health in those, it's called Medicaid. What we call mass health here, they call Medicaid, or different things in different states, but it references the Medicaid program. I'm sorry, I'm not familiar with that. I can get back to you if you want to take my card. But yeah, I'm not as familiar about that. We also have people who are, there's 3 of our staff members who are trained as assisters with mass health programs. I'm not one of them, but I refer people to folks who are all the time. Cool.
Is there a difference between supplemental and?
Yes. So a Medicare Advantage plan, what that means is it is different than a traditional Medicare plan. If you switch to a Medicare Advantage plan, you no longer have traditional Medicare. All of your Medicare is administered by that plan. Supplemental is you are purchasing this because whatever Medicare you have doesn't cover everything that you need. So you purchase an additional supplemental. You purchase additional supplemental insurance if you have some additional specific needs. So a little different. For instance, you can have a traditional Medicare plan and a supplement, or a Medicare Advantage plan and a supplement. Yeah, I think that this is, for your case, I think it's a job for Shine, for sure, because it really depends on the specific plan. All I was referring to there is that, in some cases, people will sign up for a Medicare Advantage plan because of things like no premiums or dental, and then it turns out that it doesn't cover some other kind of care that is really important to them. So that is what you just have to watch out for. And also, like you said, there's also additional risk put on people because it's not a pay up front, it's pay as you go. Any other questions? Again, I'm happy to stick around for a little bit afterwards if people have them, and I have my card as well. Mm-hmm. Cool. Well, the last thing I'll say then is that, we try and, like I said, get the word out about these things. But if you're at all interested in, learning a bit more about Mass Senior Action and what we do, the way that people typically get involved with us is through our monthly chapter meetings. So again, the closest chapter here to Wellesley is our Cambridge-Somerville chapter, which meets in Cambridge in Central Square at that senior center. If you're able to get to that, then great. If not, you are able to join virtually, and if you have trouble with that, we have helped a lot of people be able to join that way. But essentially what these monthly meetings is we'll have a speaker. This month, we're actually going to hear from our executive director, who is going to talk about a lawsuit that we were recently a part of where we sued the state for not providing enough home care options as opposed to nursing care. We got $1 billion settlement, and we're working with them on administering that over the next 8 years or so. It's exciting. So we're going to be hearing about that, but different months we may have elected officials, city councilors, state representatives come by and talk with us. We learn about the issues. We get a chance to discuss some of the upcoming things we're doing, like visits to the State House or working with another group on a certain issue. And yeah, it's a chance to see and talk with other folks about these issues that are really important to seniors. So again, if you're at all interested in membership, it is $10 a year. With membership, you get to hear about these monthly chapter meetings, and you also get that newsletter 4 times a year, the Senior Action newsletter. So if you're at all interested in that, find me afterwards and we can talk. Any other questions?
I have a very dumb question.
No dumb questions.
Here, the definition of income.
Yes.
Does income include Social Security?
Yes. Income includes Social Security. It also does include, for instance, if you have an IRA or pension, anything where you have those disbursements coming in as well.
Because
it's all that
to
combined.
Me, income means you're working, you get
Right.
salary,
Yeah. No, it's any form of income you have, including Social Security. Yep. Cool. Okay. Yeah, happy to stick around and talk with anyone who has any other questions. But sure. Yeah. If you come up and talk to me, then for sure. Thank you, guys. Thanks for having me.